Today, in fact, oops. Today, in fact, Helen Pang was a leader in having a virtual career fair at Anza College with over 60 employers and had about 400 student registrants. So without further ado, I introduce Helen Pang.
Thank you so much, Yvette. Welcome, everyone. Again, and it's an honor to be moderator for this special panel. And one of the reasons is as a career counselor, I meet with many students to discuss their career interests and ideas and goals. And a lot of students have said that they're really interested in healthcare careers. So this panel is an opportunity to show you the different careers and how you can take your passion to the next level. So for now, I will introduce our panelists. So Dr. Jennifer Domingo-Mihalko, MD, obstetrics and gynecology specialist at the Clara Valley Medical Center. And she received her medical degree from University of California, San Francisco School of Medicine and has been in practice for more than 20 years. She specializes in the women's reproductive tract, pregnancy, and childbirth. She is OB/GYN residency program director and attending physician. Obstetrics is the term for women's care while in the prenatal and expectant states, while gynecology relates to the care for general women's health in a non-pregnant state. OB/GYNs can diagnose and treat a wide range of conditions and can work as primary care doctors for women. We have Dr. Dina Salvador, MD, Senior Physician, Department of Adult and Family Medicine. Dr. Salvador grew up in Oakland, California, and attended high school at SJND in Alameda, Go Pilots, and completed her undergrad at St. Mary's College in Moraga, California, where she graduated with a Bachelor of Science in Business Administration and Economics. Dr. Salvador had every intention to pursue her MBA. However, during her junior year, she switched career paths to pre-med after taking a chemistry class at Laney College in Oakland. Dr. Salvador attended Ross University in the island of Dominica for medical school, where she spent a little under 2 years for the basic science curriculum and then completed clinical rotations in Miami and New York City. She completed residency training in family medicine at Pomona Medical Center in Pomona, California. Dr. Salvador has been at Kaiser since graduating residency almost 7 years ago. In her free time, when not in a pandemic, she enjoys traveling internationally, swimming, and yoga. She has also pursued her interest in cooking, but so far has not been very successful. On the weekend, you'll usually find her in the Oakland Hills with her dog, Luna. Dr. Salvador is happy to answer any questions regarding her journey in medicine. Gabriela Carranza, physician assistant in family medicine, Stanford Healthcare. She is a proud Chicana, born and raised in San Jose. Gabby, as she is known to her family and friends, received her BS in biology and minor in chemistry from San Jose State University. Gabby's path to becoming a physician assistant was a non-traditional one, having gone back to school after working in healthcare administration for approximately 9 years. She eventually went on to earn her physician assistant certification from Stanford Medical School and her master in medical science from St. Francis University. During her work as a primary care provider, Gabby also fulfilled her innate love for teaching as a clinical instructor at the Stanford PC AP program. She had to take a step back from teaching a few years ago, but continues precepting PA students and working with Comet scribes at Stanford. Gabby believes strongly that any dream is possible and states it doesn't matter how long it takes you to get to your dream as long as you create a plan and keep moving toward it. In her spare time, you can find Gabby enjoying her evenings or weekends, being active with her four-legged pitty daughter Lala or spoiling her firstborn niece, baby Cece. Dr. Rosafel Nogra, clinic director, family nurse practitioner. She has over 20 years of clinical nursing experience in primary care and young adult setting and supervisory leadership role in college health setting. She received her BSN MSN with emphasis on Family Nurse Practitioner, International Health Options at California State University, Los Angeles. She completed her Doctor of Nursing practice at Maryville University of St. Louis, Missouri in 2014. Her dissertation focuses on binge drinking behavior and sexual violence among community college students. Dr. Nogra has been the Director of Student Health Outpatient Clinic at Stanford Healthcare System for 13 years, and she is now the Clinic Director of the Anza Student Health Services since 2019. In addition, she taught the Adult Geriatric Nurse Practitioner clinical coursework to Master's Nursing students at the University of California, San Francisco, and Family Nurse Practitioner program at Holy Names University. And Dr. Will Fermender, PhD, Director, Licensed Psychologist, and Director of Psychological Services at De Anza College. He moved to California after spending his childhood, adolescence, and early adult years in South Carolina, Washington, D.C., and New York City. His clinical and research interests include diversity in community mental health, public policy, program development and evaluation, and therapeutic sports interventions. He has a great deal of experience helping clients deal with stressful life transitions. Using a combination of humanistic, behavioral, and attachment approaches to psychotherapy, he aims to help clients feel comfortable with themselves, feel less self-critical, and feel capable of making and maintaining meaningful life changes. Such changes are based on substantive collaboration with clients to create tangible, realistic, and attainable goals. So again, welcome to all of our amazing panelists today. And I will go ahead and ask the first question. Please introduce yourself and tell us a little bit about your family and hometown, your journey through college, and your career. Feel free to identify the ways you show up in your intersectionalities as well. And we can start with Dr. Jennifer Domingo-Mihalko.
Okay. Hi, everyone. And I want to thank Adriana for inviting me. So a little bit about my background. I actually am from Southern California. I grew up in Oxnard, which is a farming community. And back in the day when I was a student, probably only about 10% of our high school actually went to university. And I would say that I ended up going to UCLA. I was really fortunate to have parents. They were immigrants. My dad did not go to college. My mother was a teacher back in the Philippines, but when she came here, worked in the farm fields. And so that was kind of the background family I grew up with. But they helped me develop that sense of work ethic. And being that my father never went to college, it was super important for him to make sure that we had a college education. And so that was, fortunately, that was kind of the principles of growing up, was you increase your opportunities by going to college. And so I went to UCLA. When I was there, in retrospect, I had a job where I tutored for it was called the Academic Advancement Program, and it was actually for minority students. And it was a place they went to help them succeed. And part of that program was tutoring. And that was my job. And that was kind of, now when I look back, that was my first kind of introduction to, wanting to help people, wanting to make sure that I could encourage minorities to go into medicine, helping them succeed. I didn't know that at the time, it was a job, but that's where that passion started. I went to medical school, and now I then I did residency, and now I work at Santa Clara Valley Medical Center. That is a county hospital, and I have been there. I am on year 25 this June. And really the reason I work there is I believe in the mission of that hospital, that healthcare is a right, and everyone in the community, regardless of your ability to pay, regardless of whether you have insurance, you deserve quality healthcare. And that has been my mission, my passion for medicine. the reason I stay there, the reason I work there. I feel like my patients teach me a lot about how to even be a better person. And so they do as much for me as I do for them. And that's why my career there has been rewarding. The other part of my job is that I also am involved with education. My hospital is a teaching hospital for Stanford and also has residency training programs. And I'm actually the director of the OBGYN residency program. And I spend a lot of time reading a lot of applications. And so I feel like I can answer any type of questions about journeys to medicine. I do want to say that given all the events of the last year, in medicine, we have declared structural racism as a healthcare crisis. And what I see in my role is really trying to encourage more people of color, more minorities, more people of color to join the force of medicine, because we really, really need all minorities. I mean, I'm not even talking about ethnic or LGBTQ, everything, all what you would call disenfranchised, all of those populations. We need those people in medicine. And so any questions I can answer about helping you on your journey, sharing experiences of other applicants. I do want to say one of my new interns this year was a Anza college student, and then transferred, to a university, and that is a wonderful path for people to take. So I'm going to pass it on to the other panelists, but yeah, I'm happy to help answer any of those questions in terms of encouraging you on your journey.
Thank you so much, Dr. Domingo-Mihalko, and for bringing up, the issue of equity in healthcare and your passion in it. Thank you again. So we will have next. Dr. Salvador, if you would like to go next, introduce a little bit about yourself, your journey through college and career, maybe anything about your family or hometown or intersectionalities as well. Thank you.
All right, can you guys hear me right now? Hello? Yes? Okay, perfect. Hi, I'm Dana Salvador. I grew up in Oakland, California. My parents, both immigrants from Mexico. Neither one of them went to college. My dad worked as a waiter, my mom as a housekeeper. I'm one of three. My sister is also a doctor, OBGYN. I stayed local for high school and college. I wanted to do MBA, kind of like my bio says, and then decided I hated business. I hated it so much that I was like already stuck in my business bachelor's, that I decided to just finish that off, take all my pre-med classes, my last 2 years of college, and apply to medical school. I did not get into medical school the first time, which is how I ended up getting into the Caribbean, which was a means to an end, and it brought me here. Did 2 years in the Caribbean and then 2 years in New York, and then decided that I wanted to be a surgeon. I applied for surgery residency, and I did not get into surgery residency, and so I had a whole year to rethink what I wanted to do, and decided, you know what? I like family medicine. It gives you a little bit of opportunity to do everything. So decided to do that. And I'd always wanted to work for Kaiser. It's kind of weird for somebody to say that, but I was born at Kaiser Oakland. I received all my care at Kaiser Oakland. And I decided that, you know what? If I graduate in medicine, I want to come back and work for Kaiser. So I got a job offer for Kaiser Richmond. And I've been there for 7 years, adult and family medicine. I see everything from kids to 101-year-olds. It's a great place to work. It's a great practice. And I'm happy to answer any questions you might have. I mean, it's not an easy path all of the time, but you know, just anyone can do it, I think, for the most part. And that's pretty much it.
Thank you, Dr. Salvador, and sharing some of the challenges you faced as well and your encouragement for students. Next we have Dr. Carranza.
Hi, everyone. Can you hear me? Yes, great. Thank you. I'll make a correction. I'm not a doctor. Maybe someday a PhD, but not yet. My certification is a physician assistant. So I am born and raised in San Jose. I went to Andrew Hill High School, and I actually think I took a class at Anza College for one summer. So I'm really happy to be here and share everyone my journey. Mine is a little bit non-traditional. I did my undergraduate at San Jose State. I got my bachelor's in biology and minor in chemistry. Initially, I was pre-med and didn't really have the best focus as an undergrad. So I ended up moving to Los Angeles shortly after graduation. My sister got a job there in advertising. I thought, sure, why not? Something new. And I kept working in the healthcare field. I actually started thinking about going and getting a master's in public health and doing like health administration. And my last job prior to applying to PA was, or one of my jobs prior to applying to PA school was working at Planned Parenthood as a clinic manager. And what I enjoyed the most was actually training the medical assistants to work with patients. And I realized I was missing that patient contact. So I had to really sort of evaluate everything and figure out how I was going to get back into school, because this was already 8 or 9 years out of undergrad. And so, you know, having to go back and take some of the courses because they had expired. But it was the best decision I made, was to go back to school. And I had looked at all my paths. Was it going to be NP, PA, or MD? And PA made the most sense for me in terms of timing and what I could do with that degree and the flexibility that I could have with it. And so now I'm back in the area. I did my, as I said, my PA certification at Stanford. I worked for a couple of community clinics in Hollister, then back to San Jose at Foothill Community Clinic. And my most recent job is doing family medicine at Stanford Healthcare in primary care. And it's, as Dr. Salvador said, it's rewarding to see patients from birth to, I think mildest patients maybe 98, so not quite in the hundreds. But it's just lovely to see the families. I get families, I see the parents, I see the kids. So I've always done family medicine since graduation, and I just really, really enjoy it. So here really to emphasize that you can decide to go back to school at a later age. It's not impossible. Just figuring out what the goal is and creating the plan, and then just really sticking to it as best you can. Things will come up, but really staying focused on the end goal is most important. So thank you again for happy to be here.
Thank you so much for sharing and letting students know about all the different options and paths into a rewarding healthcare career field. Thank you. Next, we have Dr. Nogra.
Hi, everybody. I'm glad to be here and welcome to this panel. Again, I appreciate everybody's effort to be here and stick with us and kind of share our experiences with the group. My career actually started way back when I was maybe 16 years old. I was not born here in the state. I was actually born in the Philippines. I came in here when I was 16, and by 16 in the Philippines, you're already done with high school. And I started in college there taking dentistry. I think for some reason I want to be a doctor at that time, more in the dentistry part. But when I received some of the classes and the coursework, I figured, you know what, I want to be in a variety of fields besides doing the workup in the mouth. But when I came here in the States, I actually went back in high school and went back to junior year and repeated my junior and my senior year. And that's when I started volunteering in the hospital. I figured, you know, I still want to continue with the medical field. So I ended up going to El Camino Hospital in Mountain View and just basically learning what the hospital environment is in the States. And after learning, you know, I shadow, that's what they call you know, candy stripers, because I still wear those candy stripes in the hospital. I shadow an RN one time. And I really fell in love with that career. I think I saw myself doing that, taking care of a patient, helping them, assisting them, doing the holistic thing for a patient. And that attracts me with this career. So after volunteering, there are so many opportunity for scholarship program. So I applied at their scholarship program and actually got the funding. So I went after my high school here. I went to the Anza. So the Anza is my alma mater. I graduated with an associate degree in the Anza in nursing. And during those 2 years I stayed at the Anza, I actually got another scholarship. So don't stop applying for those scholarships. So my last 2 years at the Anza, I'll be honest with you, all I did was really pay for my books and some of the items, some of those fees, but my tuition fees are free. And I still want to pursue. So after I did my associate degree in nursing, I feel like, you know what, I'm going to go ahead and continue my bachelor. And I love quarterly system. And I found a school in Cal State University in Los Angeles who's offering quarterly system. So that's the reason why I transferred in Cal State LA and be a little bit more independent, to be honest with you. And from then on, my career kind of shoot all the way up, and slowly I start learning the different fields in nursing, from going to the associate degree, doing the bachelor's, and then I got explored in public health. Then I fell in love with public health after that. I thought I'm gonna start going to my school and I want to work for public health department. And one of my colleagues in college say, why don't we try a nurse practitioner program? And I don't know what nurse practitioner program is. I have no idea what that career is. So I just jump in and say, let's do it. And again, the last 2 years, there is another scholarship that they're offering, and I applied again. So I got the scholarship in the last years of my NP career. Again, I got free tuition fees in that school. And then this is the first NP program where they do international health nursing, nurse practitioner, where our last preceptors or our last clinical site is we have to travel to one of those countries that is listed in their program. And I have the opportunity to travel in Guatemala and experience doing a lot of medical missionary stuff there for at least 3 months. And again, I fell in love with what we're doing for this population. And after that, I become involved with primary care practice after I graduated. And there's one opening in college health setting, and I figured, I'll apply. And once I know about the student health services, what they offer, I admit I love working with students, and my career just moved on with college health for 13 years. So the last job that I have was affiliated with Stanford Health System. And this is where we have a lot of affiliations with different groups, with different communities, a lot of referrals. I do a lot of referrals from different entities in that community. And when the contract expired, that's when I moved in here at the Anza, going back to my alma mater again and serve my own community. And this is why I'm here. And I thought I'm gonna stop, and I guess I continue moving on with my doctorate. So I did the long route, to be honest with you. Don't stop, again, don't stop trying. I tried it a few times. I actually failed going to the first doctorate degree program. And I tried again and finally I got in. And the reason why I did the doctorate is I love teaching, I love students. When I finished my career, I had an opportunity to work with UCSF and Holy Names University in their clinical, as a clinical faculty. So again, don't stop believing in yourself, keep moving forward, and it's not too late to start your healthcare career. So that's all I have to share for now.
Thank you so much, Dr. Nogra. Yeah, that was very inspiring how you came full circle and grew your career in nursing into so many different areas like public health and even international settings, right? Yeah, thank you so much. And next we have Dr. Furmender.
Right. Hi, everybody. Thank you all so much for having me. It's been great to hear everyone's background here. I'll share a little bit about mine. Hopefully it's as interesting as everybody else's. Rosafel mentioned how she was from, Dr. Nogra mentioned how she was from, she's from the Philippines, came here when she was 16. I'm from South Carolina. Sometimes upon being here in California, I feel like maybe I'm from like a different country as well. I grew up there for 18 years, and you know, I always knew that I was going to move when I went to college or when I turned 18. You know, South Carolina is very nice, it's very pretty, but you know, happy to move to a place that more meets my you know, personal, religious, and like moral values. To a place like California. I started off by going to New York City for college, where I, like so many people here, was going to take a pre-med track. You know, but science was never really my passion. So I was a philosophy major while taking the pre-med requisite courses, and I got through chemistry and biology and physics, and those were all pretty fun. And then some of you might have experienced this too. I took organic chemistry. All my friends were like organic chemistry geniuses. We went to the first lecture. The professor has 5 whiteboards up on the wall. And I turned to my friends, and I'm like, y'all help me get through this, right? And they're all like, yeah, sure, we got you. So I was like, okay, I can probably handle this. And then I went, the next day was our organic chemistry lab, where I went to lab and realized that you did organic chemistry lab by yourself. And I was like, wow, this is probably more work than I'm willing to dedicate to being a senior in college. I would like to enjoy my life this year and maybe not spend every waking moment trying to get like a C in organic chemistry, as was probably going to be the case. So I like rather impulsively, as I look back upon like 20, 21, 22-year-old Will, and like walked up to organic chemistry TAs, was like, I know there's a wait list for this class, please give my spot to someone else. You know, politely walked up like 9 flights of stairs to my like advisor's office and was like, all right, time for plan X, or you know, something besides this. And you know, with a philosophy major, not a whole lot of obvious career paths to, you know, in the 21st century. Maybe in like the 18th century, one could be a professional philosopher, but it's a hard profession to get into these days. So my advisor was like, hey, how about, intro to psychology is open? And I was like, that sounds like great. I've always enjoyed psychology. A lot of the philosophers I've been studying have also been like psychologists of the day. So took a psychology class, really enjoyed that. Took another like statistics class, and then another psychology class, and was like, all right, this is something that I feel like I could do. So right, over the course of like 6 months, went from studying for the MCATs to studying for the GREs, went from looking up med schools to looking up PhD programs. And right, it ended up, working out well. I got into one in California, a place that I really enjoyed being. And I think that in terms of the PhD program itself is a little bit different than the degrees that have been described by the panelists before. Is in the it's not a you're not going to medical school for it. You're not getting quite the same background in like body chemistry you might in other classes. It's a little bit more of a not to say that none of the people who in it have a relational side to them, but it is more research based and a little bit more relational. You're spending maybe a lot of time with your client to be able to get a sense of like what really what they're going through and how we might be able to help. So I'd be happy to happy to be here, happy to join in the conversation any way I can.
Thank you so much, and for sharing your journey into mental health, and that's also a very important part of healthcare as well. So thank you all again. And right now I have more questions, but I can open it up to students. If you have questions, please, you can put it in the chat box, and then we can ask the panelists. And you can even direct specific questions to specific panelists as well too. I'll give you a minute if you have questions, and then if not, then I can ask the next question as well.
Helen?
Yes.
I had a specific question, and I was hoping maybe Gabriela can expand on that. She mentioned briefly how she looked at different programs, and because some of our speaker series is a sort of continuum journeys for people. I'm wondering if Gabriela can kind of expand on that, like what made you choose NP, or if there was a certain reasoning behind that versus, I'm sorry, PA versus NP, and kind of what was your divergent point and your thought process on that, because oftentimes that is a question sort of in the middle of people's journey. And I think it's important that people realize there is kind of a continuum process. And so I was hoping you could expand on that, why we were sort of prompting questions from the students.
Unmute.
Hello?
There you go.
Okay, thank you. Okay, yes, so when I decided to go back to school, I really was looking at what's going to be the best option for me. Again, when I was an undergrad, being a physician was my dream. And I thought, well, if providing care is the ultimate goal, how can I really achieve that? That's really what I wanted to do, was to provide care for patients. And so I looked at NP programs, but then I realized you have to have an RN license in order to apply for an NP program, which I didn't have. So that's an additional 1 to 2 years to complete that. And then doing clinicals, and then, then applying for an NP program. And I know they have accelerated programs, but it's also, adding on an additional year still to do the the RN portion. For MD, I thought, well, I can do a post-bac program, which is after undergrad, but before graduate school, which can be anywhere, again, 1 to 2 years. Then I'd have to study for the MCAT, then I'd have to pass the MCAT, and then apply to medical school. Then medical school's 4 years, then residencies, a couple of additional years, depending on where you want to go. So that was like, I'm looking like at 10 years of possibly before I can practice as a provider. And then looking at the PA program, and for all of them, I had the classes, but I had to retake them, a few of them. And so the PA program, I just needed, some of them required was it the GMAT? Yes, I can't remember now. Not all of them did. Stanford at that time was one that did not require any additional testing before applying. And the program at Stanford at the time was a 16-month program. And I had all the prerequisites except for a few of the classes that had expired. So again, for any of the 3 that I wanted to do, I was going to have to go back to school and take some of the courses over, which I knew. But in the end, it made sense that the fastest track for me was going to be going directly into a PA program. It was just a matter of getting all my ducks in order and taking the classes, taking any testing that was needed, and then applying and hopefully getting in. The first time I applied, I did not get in. I only applied to one school just to see what the process was going to be like. And I was still taking community classes at community college. I think I ended up taking chemistry again, anatomy, physiology. I had never taken anthropology, and that was a requirement for like one of the other schools I applied for. So I ended up doing that one. It was really interesting. But that's sort of the process. And I just really laid it out all on a paper. I said, okay, this is the NP track. This is the PA track. This is the MD track. What makes most sense to me? And PA is what ended up working out. I applied and I got into 3 of the 4 schools I applied to. And I wanted to, at the moment I was in Los Angeles, I wanted to come back to Northern California. So Stanford was a great choice and a great school and a great program. And it was the fastest program. It was also at the time, it's no longer anymore, but at the time it was associated with Foothill Community College. So the cost was much more, it was much more reasonable than it is now, unfortunately. Now it is a full-time master's program with Stanford. It's a great program, but you will now be paying Stanford fees, which is a lot more than what I had to pay 10, 11 years ago. So.
Gabriela, thank you so much for that extra information and kind of the little plug addition and how the community college system helped you out and supported you during that process. Thank you. Thanks, Helen. There are no questions at this time.
Okay, so if there are no questions, I can ask the second question. And so the second question is, what is the favorite part of your job or career? What are some challenges? Maybe what's your day-to-day life like? If you could share that. And if anyone wants to start first, you can start first, or I can also call on each of you. Okay. Okay, I can call on each of you then. Rosafel, would you like to go?
Sure. I think my favorite part is really working with college health. And I got to, it's a variety of field that I always does in the clinic. I do clinical part on a couple of days. I go on meetings and events, planning a big event in our campus the next day. And I go presenting in a class the following day. So I wear many hats in our clinic right now, and which is what I love. It's my passion. And working with my team has really been an excellent journey for me. I have a very supportive team, and that plays a big role on my end. Challenges, I think, challenges for me as far as my career is concerned is really it's more on the outreaching. I want to make sure that there's enough outreach going on in our community, especially with those low-income students. Those are really the challenges in my career right now, is finding them the right insurance, the right services, the best services they can get. And I know there's a lot in our Santa Clara County residents. However, it's still challenging for them to get those services, especially hooking them up to Medi-Cal, for example. And second challenges is dealing with mental health in my community, in my population. Referral is a big thing on my end, and I'm always open to exploring partnership from different providers and communities out there, so that there's an easy access for continuous of care to my students I'm taking care in our college, and passing them on to the provider outside. So
Thank you for sharing. Yeah. And I think, it looks like we do have a question from a student. What major other than a science major would best prepare you for medical school? So anyone can answer?
Yeah, go ahead.
All right. So, I mean, it's kind of like a tricky question because nothing really prepares you for medical school. You just have to have your pre-meds to get into medical school. And after the first semester, it's all a level playing field. My sister was a history major. I was a business administration major. So really, you can take major in whatever you want. Just make sure you take your pre-med classes. So it's always a good idea to do something that you really, really, really like and are interested in college, and then also take your pre-med classes. But traditionally, most people do like chemistry or biology. I didn't, and it worked out okay for me.
Thank you. Yes. Jennifer, did you want to add anything?
Yeah, I mean, I wanted to echo what Dr. Salvador said. I read lots of applications, and I think that the best way I would answer that question is study what you have a passion for. Just like William said, if you hate science, do not major in something science, because you're going to be miserable. And I think that, and another important part of college is just figuring out who you are and what you're passionate about and what you enjoy. And I have had people that have been professional ballerinas going into medicine, people that have had traditional careers of, bio majors, lots of English, anthro, psychology. So my answer to that would be, what will matter are your grades, right? Unfortunately. And so you're going to have the best GPA if you're studying something that you really love, and then of course you have to do the pre-med coursework. Many people that graduate and have jobs or careers that then decide that they want to go back will do a post-bac program, which you can do, and you don't, in some ways that might be easier because then you're taking your post-bac science classes, like maybe at a community college. And then so you're not so stressed out and around all the pre-med people. I mean, that kind of an environment might be better for you and may help you succeed better as well. So.
Thank you for sharing that and adding that information as well, and letting students know about all the different options that they can take. And yeah, I think we have another question from a student.
Yeah, we had a question. Let me get back to it here from Jessica. And Jessica posted a question I get a lot from students, especially when we have panels and professionals. Jessica in particular is a psychology major, and one is wondering if the panelists participate in internships or are offering internships, or do they know of anyone who offers internships? And I think this speaks to a broader skill that we try to teach students about networking and asking questions and getting in there. So does anyone have any contribution to that thought? Like, are you personally within your status and location and job now offering internships? Or if someone was looking for an internship, particularly psychology for Jessica, how would they go about looking into that?
Yeah, so I can take a stab at that one. You know, within our department, right, so we don't offer student internships in our department because we're dealing with a lot of confidential information, and we're dealing with people who would be like peers of the students. So I think one of the things that I would recommend is the agencies that most need people to help support, maybe to run kind of maybe like peer-led groups or something like that, are like our community mental health organizations, right? These are the places that, you know, it might have rely on like donor funding, or they might rely on like you know, governmental funding that might not be enough to cover all their staffing needs. And so, you know, there are you know, infinite community mental health organizations, or just community health organizations, right? Don't want to shorten it to just community mental health. I'm used to saying that, obviously, from like my job, but I'm sure, you know, there are many community clinics around who maybe are taking on people, like when Rosafel's mentioning her time as like a candy striper. Pretty sure she wasn't you know, paid for that. It was probably like an internship for her, maybe at a hospital, or for like local agencies. So a lot of yeah, community mental health organizations will be looking for you know, people who are passionate about a particular topic to maybe come and assist. Yeah.
Yeah, thank you, William. And oh, we have another question.
Yeah, so this is from Karina. Karina is asking a question of Dr. Domingo, but it's open to all the panelists. You brought up institutional racism and how that greatly influences the medical field and the level of care our underrepresented folks are receiving. What are you, Dr. Domingo, and any panelists, what are you currently doing or are seeing being done to help break down these barriers to receiving the healthcare needed? And what hopes do you have for the future of medicine and its relationship with the said populations?
Yeah, Karina, that's a big question. It's a loaded question. You know, I think, you know, I see the literature from our OBGYN arena, but because I'm also involved with graduate medical education, you know, this is also being brought up, you know, in that venue. And I think in medicine now, there's a lot of research where we basically show that there is all the healthcare disparities, you know, worst outcomes with disease processes, and you see them in communities, communities of color. And what my residents and what we're being taught is has nothing to do with race, but it has to do with racism, you know, and all the things that structural racism brings to being able to provide good education, to provide access to care, you know, understanding someone's barriers to health. You know, why is it easier for, you know, it's easier for me to say go exercise and have a healthy meal, but when, you know, when you're a mother of 4 and you cannot afford that, you know, how do you do that? And so all of these social determinants of health are a big part of medical school education now, what I am starting to see in medical school, in medical students, is how they are bringing up these issues in just the lessons of medical school. This was nothing of this was brought up when I was a medical student, but now the current students are being taught. There are fellowships, and there are medical schools that provide tracks for people who specifically want to work with the urban underserved, or who want to work with rural underserved. And so there's a lot of emphasis in medical school where you can join these tracks, where you can look at specializing, yourself. And then after medical school, when you apply to residency, you have a lot of choices as to what kind of a program, what kind of an environment, what kind of patients that you work with. And then eventually also, once you finish residency, there are programs, which you can sign up for, knowing that medical school education is expensive, that will, be scholarships or help you pay. There's the National Health Service Corps. There's a couple of programs out there that if you commit to working in an underserved area, you can get your medical school paid for, so there are those options. What I am really hoping with all the change, especially in the last year, is that we build a society that starts to understand the effects of racism and how it affects the health of individuals. And I am on a personal journey myself to learning more about that. At our institution, our department, for example, developed, it's called the Health Equity Anti-Racism Task Force. And I'm on that task force. And we are bringing to light all of these problems. We're looking at research, we're looking at diversity, and how do we increase the number of residents of minorities and underrepresented underrepresented minorities. How do we recruit? How do we bring them into medicine? One of our statistics is that in OBGYN, probably only 2%, of OBGYN physicians attendings are of African American descent. And we definitely need to increase that. We only have less than 10% of medical students across the country are Hispanic or Black, and we need to increase that. And so, there's a definite push, in medicine now to really look at part of fighting structural racism and improving health equity is also diversifying our workforce, so there's a lot of, I think, I'm hopeful, there's a lot of efforts in recognizing this, and everyone working toward that. A lot of it is just education. Now in California, institutions are being required to teach everyone about implicit bias, and how implicit bias, affects the way we deliver care. So I think that these are, movements that are starting to address racial inequities. We have a long way to go. No one's going to lie about that, but at least our eyes are open, the efforts are there, and as long as we stay the course, that's all we can do.
Thank you so much for sharing about that and bringing that up. And it's definitely a very important issue. I was wondering if any of the other panelists would like to add to that in terms of maybe how do you bring social justice and equity to your work?
Just very briefly on my end. Again, I'm also a professor at UCSF, and UCSF is a big diversity campus where their number one emphasis is health disparities and addressing those social determinants of health. When I do my health promotion teaching, that's one of my biggest priority is educate my students about health disparities. One of the things that we practice is really to get to know your patients, culturally. You need to understand their culture and have a building relationship with your patient so that you can address those determinants at earlier on, and it will increase compliance as well. But overall, I appreciate Dr. Mihalko for bringing this issue because it is big and we're just getting there. And hopefully as a clinician, we'll be able to emphasize the importance of this. So just want to put that at the end. So thank you.
Thank you, Rosafel. Anyone else would like to add to that?
Let me just add that, some of you may know, some of you may not know, psychology has a really terrible record of, taking advantage of people of minority backgrounds. And so, I think a lot of this starts with, acceptance, taking responsibility for that, saying, hey, this is a new wave of what we're trying to do. The psychologists of today, the physicians of today, the nurses of today, they care about, physical health, and they care about mental health, and they care about systemic racism, and they care about the barriers that different people face every day to get basic services. And they're aware of what's going on out in the world and within the community, right? We're aware of Black Lives Matter. We're aware of defund the police. We're aware of organized violence against AAPI communities. We're aware of anti-LGBTQ plus organizations or anti-Semitic organizations. We're aware that these things exist, and we may not be proactively bringing them up to every client who might identify that way and say like, oh, hey, is this necessarily a problem for you? But if it's something that does come up, I want to stress with with every healthcare provider here that this is something that we want to talk about with you. We want to help you. That we want to try to make sure that there is safety in your life, because one of the main how should we say, philosophies that we all have is that happiness starts with safety. It starts with feeling feeling loved, feeling safe, feeling supported. And it's hard to study for a test. It's hard to you go to the grocery store if you don't have that inherent feeling of safety.
Thank you. Any other panelists would like to add to that? Okay, if not, I think we have another question from a student.
We do. Thank you so much, panelists, for addressing that issue. It's actually one of those things that permeates every aspect of health. So it's a super timely topic for us. Stephanie brings up a great question for those of us who are on our lifelong learning journey. She says her question is, after completing the prerequisites for a nursing program, there's usually a long wait list and in order to actually start programs. So I think as Gabriela mentioned, she actually had to repeat some classes. So as people and students get prepared and they're ready, then there's this long wait. What do you as panelists and experienced providers, what do you recommend doing in the interim, in the waiting time before actually starting your official licensure or your advanced program?
I can share. Can you guys hear me? Yeah. So one of the things I was doing was still working in healthcare, just in different aspects. Clinic manager at Planned Parenthood. When I was an undergrad, I actually worked as a medical assistant at Planned Parenthood. It's one of the few locations, it's still, I don't know if it's still true, but I think it is. You don't need a certification as a medical assistant to work there. They will train you to be a medical assistant at Planned Parenthood. So that is always an option, or at least one that I found to be helpful for me. The Planned Parenthood that I worked at had both women's health, men's health, and primary care. So finding a job in the medical field is always a good option. And you don't necessarily need to go back to school to do training, but if you did to become like a licensed medical assistant, that's great too, because then you can work at the bigger facilities like Stanford, Kaiser, etc. But that's one option that I can suggest.
On my end, when I was waiting for same thing, I'm waiting for the program. I actually started as a CNA as well, certified nursing assistant. Only lasts for about 6 months because I got in the program after one semester. However, even after your school, you still need to wait to get your RN license. So same thing, when I was waiting for my RN license after I'm done with school, I end up working as a utilization case management in an office, like coordinating their medical insurance and doing a lot of the front office end from what Gabriela said. So that can kind of give you a little bit more of an overview of what is in the medical field. And then also there's always a chance of volunteer work. I think if you really want to explore the area of the hospital settings in different aspects of the hospital and the field of professionals working there, it may be a good opportunity for you to look at their volunteer opportunity. You don't have to waste any money. It's a free service. No classes that needs to be taken. Maybe just explore those items and see if you really want to be in that field. So just sharing that experience as well.
Thank you for sharing again. And anyone else like to add to that?
Helen, this is Deborah. I have my hand up. I don't know if you can see it.
Oh, okay. Yeah, I don't think I saw it. Yeah.
Good evening, everyone. I'm Deborah Taylor, and I'm the recruiter for the nursing program here at the Anza. Shout out to all candy stripers. I want to say that I have been one. So in regards to Stephanie's question, I'd like to highlight some of the health technology courses here on the Anza's campus. So we have a phlebotomy class, an EKG class, and also medical terminology. So while you're on the wait list, if you're already on it, in addition to doing the CNA, you can take some of those other classes because they also will be beneficial for you as a nurse.
Thank you, Deborah, for adding to that. Yes. So, do we have any other questions? Okay, so while students might be thinking more questions, I can have maybe the panelists who didn't get to share about some, the day on the job, or what do you enjoy most, and some challenges if you'd like to share. Mm-hmm.
As I mentioned, I do primary care at Stanford, and it's always rewarding to just be of service to my patients. I feel like this pandemic has just been the craziest year of our lives, and the need for mental health services has been skyrocketed. So it's sort of what I enjoy, but it's also what's been most challenging. We think of primary care as just your physical health, but it's so much more than that. And I think on any given day, I'm talking to at least 40% or more of my patients about their mental health and what we're going to do about it, whether it's we're just starting to discuss anxiety, depression, PTSD, and what resources are available for them, or if we're already talking about medications that we can get started on. That's been an everyday, pretty much since the pandemic began. So the challenging part has been the resources, where I'm asking them, you need to talk to a therapist, but where are we going to find one? Because every time I give them a list, they've gone through the list, and no one's taking new patients, so they're not getting callbacks. And our own department is overwhelmed, where there's a wait list. Our own social worker is overwhelmed, where she's got a queue of a lot of people just waiting to talk to her. So sometimes they're just checking in with me periodically just to see how things are going and making sure that they're okay for the moment. But it's been hard. It's been really hard. And as a provider, you have to take your own mental health into account as well, and making sure that you're checking in with the people that you love the most and have your support team. And that's how I've gotten through it as well. Just with the family and friends that are around you, reaching out to them. And so that's been the challenge for me the most.
Thank you. Yeah, thank you for sharing that, and also sharing the importance of self-care, right? Yeah, I think that's important for all of us. And I think, William, would you like to share a little bit too about your what you enjoy about your work or challenges day to day?
Absolutely. Right. I think there's so many things to enjoy about being a psychologist, about being a therapist. to form connections with people. It's probably what, first and foremost occurs. I think, most therapists get into the profession because they like meeting people, they like, listening, they like, trying to help in whatever way we can, which typically doesn't. Some people think therapists like give a lot of advice, but typically it doesn't involve giving advice. It involves more, like listening, trying to find themes that it might be hard for clients to come up with on their own. There may be some kind of like, where what can we do to change this? What can we do to make this better for you? But yeah, right. I think like, forming, rapport and relationships with people is probably the top thing. As well as, I shared earlier, I was a philosophy major, so like, abstract thinking and problem solving is something that, that I really value, that I really enjoy. There's a lot of like complex, family relationships and friend relationships and, intimate partner relationships, right? That, that everybody has, and everybody comes from like a different place. So just kind of putting my critical thinking hat on, on a daily basis, is really a lot of fun for me. I would say, to echo what Gabriela mentioned earlier, right, the pandemic has definitely, caused, some challenges on our part. Clearly, we're all over Zoom right now. We're, doing our, our individual therapy and our group services over Zoom. There is, something different about it, although I do, still, better than a phone for the most part. So, we'll take something over nothing. But yeah, it's hard to get exactly the same, or what clients have relayed to me is that it's hard to get exactly the same feeling as sitting in a room with a therapist when you're over Zoom. It may, it's good enough. It's what we have to do right now, but there are a fair number of people who are, myself included, who are looking forward to being able to go back to the office and be able to, have time with a client, not behind a mask and not behind, not have to worry about those kind of things. So that may be, a year or two away. I'm not predicting that it's going to be anytime soon, but right, we'll enjoy it when it happens.
Yes, thank you. Yes, I know Zoom has its advantages and definitely its disadvantages too, right? Yeah. And Dana, would you like to share?
Sure. Can you guys hear me? Yes. Okay. So, I agree with what everybody has said. Part of what's most enjoyable about the work is the connection that you get with people. One of my most satisfying moments is when somebody comes in scared because they're having dizziness or this pain or what have you, and just kind of explaining the pathophysiology of what's going on and why Google's not right, you don't have cancer kind of situation is really rewarding. And also just relationships. As a family doctor, I tend to take care of family units. So a lot of the times I'll call a patient and I will talk to the mom, the dad, the neighbor, and that has its ups and downs, but for the most part, it's really enjoyable. We're definitely seeing a lot more patients in clinic. People are happy to come back, but that poses its challenges as well with the pandemic. Definitely in my clinic, people want to come in with 3 or 4 people. Usually allow one person in. So those are challenging things. Dr. Google's another challenging thing, but overall, it's a rewarding career. It's a hard career, but it's fun for the most part.
Thank you. Yeah. And Jennifer, I think, if you can share.
I love being an OBGYN. I didn't think I was going to, but I love taking care of women. I think, no offense, William, but women rock. And I think they're like the pillars of the family. I really believe like if you've got a woman that's in good health and is able to take care of her family, then that family is stronger, that's my bias. And so, I do obstetrics, so I take care of women and go on their journey with them through pregnancy. I do clinic, I deliver babies when I'm on call. And this morning I did surgery. So that's the other thing I love about being an OBGYN is I'm also a gynecologic surgeon. So I did vaginal surgery this morning on a woman who was a midwife in Nigeria. So that was, I was just so I was excited to help her because I thought, wow, what a great job you had in your lifetime. So, you know, that's one of the things I love about my job is I have so much variety in what I do. I agree with all the other panelists. Probably the best part of my job though is my clinic and just the relationships. I have, let's see, I think I have taken care, I have not had a patient who I delivered who has been pregnant yet. I think I'm getting close though. Getting close, but not quite there. But just I have some patients I've taken care of for over 20 years, and that brings a lot of joy. Challenges, I would say, one of the big personal challenges every physician has is work-life balance. I think everyone is nodding in the panel about how much you want to help patients, but there is burnout and physician, nurse, just burnout in your career is a real thing. And so just learning how to find that balance and knowing how to take care of yourself, because if we don't take care of ourselves, we can't be the best, you know, for our patients. So I personally find that as a big challenge. I think a lot of my colleagues do as well, especially being a woman, because you're usually taking care of the family. And even if you have a wonderful partner, you know, usually the moms are still doing a lot behind the scenes. So, you know, being a woman in a career and managing a family and finding balance is definitely a challenge. And then I think these challenges at work with racism and social determinants of health inequity, this is the new challenge. And I'm kind of excited. I've got my last 10 years to be playing an active role in trying to, you know, break down some of these barriers and do some good. So.
Thank you, and thank you all for sharing your passion and also some of the realities of your careers, right? And yeah, if students, if you have more questions, still feel free to put into the chat box. And if not, if there's advice, any advice you'd like to share with our students attending right now, and any of you can jump in, yeah.
I can say a few words to that. I guess it's just being clear on what your goal is. That should help sort of direct how you want to, you know, plan in terms of what you want to do. Whether, and again, anything you decide to do, you are going to be welcomed and wanted and needed. Especially as Dr. Domingo mentioned, women, you know, people of color. I can't tell you how many times I've been told, "I'm so glad you speak Spanish." And it's, for me, it's just, it's what I did. That's how I grew up. That's what I learned at home. But when patients come in and tell you that, then you remember, and I remember, I used to be my parents' translator when I was a kid. So I think that also sort of guided me as to what my career was going to be. But let it be your passion that guides you, and then just create the plan and stick to it. You know, being a daughter of a family of immigrants, you know, it's like my parents didn't make it past, my mom didn't make it past first grade, my dad didn't make it past sixth grade. They didn't know, you know, how to really support me in college. They just knew I had to go, which was great because that was what was driven into my mind. I just had to go to college. But of course, and there's a challenge that once you're there, your parents really don't know what's going on and what you need to do and how hard it is to study and how many hours it takes. And you may not come home at 10 o'clock at night because you're still in the library or with friends studying somewhere. So, but you've just got to stick to it, that if this is what you want to do, it is a very challenging career to choose. Any health career is going to be a challenging career to choose, whether it's MD, NP, RN, psychiatry, it's tough. And you've got to find your people who support you. Your family will always love you and support you. They may not know exactly how, but they will be there. And then you've got to find your friends in school. That's really how I got through it, and your mentors. At San Jose State, we had the privilege to have Dr. George Castro be the dean of college, I think my second or third year there. Never had a mentor before, and that he looked out for us so much, making sure we knew about SACNAS, knew about CHED, knew about group organizations and conferences, and it opened up our eyes in a way that my parents weren't able to. So finding those people, finding those resources, and just keep moving forward. The challenges will be there, but you will get through it as long as you have that support and you have that drive and you have that plan.
Yeah, thank you so much for sharing the importance, of your, of having a village, having a support system, right? Yeah, thank you. So anyone else would like to add to that? Just advice, general advice for students, tips and tricks?
I can do a few words here and there. I think any healthcare career, it is a little bit of a long journey. There's no shortcuts to it. Just be honest about that. Just have the passion, the motivation, and a commitment. It is a long process, but at the end of the tunnel, there's always that that light, and you will get there. You will finish. Don't stick with the time, to be honest with you. When I was at your age, I kept saying by 30 I'm done with everything, or by 25 I'm done with my career. I think again, let your passion take its course, and then plan from there. It took me a while. I think it took me like 8 years to finish everything, from having an associate degree all the way to my DNP, my Doctor of Nursing practice, but it's all worth it. And don't forget to apply to those scholarship programs. It financially is a bit of an issue, because again, anything in healthcare, it is kind of pricey. It is expensive. Be prepared for that, but don't forget about those financial opportunities. So keep applying. And again, there's grant monies and scholarship out there. Just keep exploring. So.
Thank you. Yeah, thank you for sharing that too, and pointing out that students can find resources that might help fund their education. Yeah. Any other comments, tips?
I mean, I'd like to say a couple of words. Might sound a little bit weird, but definitely echo what everybody says, but also don't let anybody tell you what you cannot do. I feel that throughout my journey through college and med school and residency, I had a lot of people telling me, oh, you don't have the best grades, you won't be able to do this. Oh, did you ever think that it's going to take forever to do that? Oh, well, maybe this isn't for you. And you just kind of have to listen to that and be like, yeah, sure, whatever, let me try. It's kind of one of those things where I just kept on going, and I was like, if I fail out, then I will fail out trying as hard as I can and not quitting. There were many times where I was a couple of points from failing a class. Like I mentioned, I didn't get into, I didn't mention this. I didn't get into residency right away. It took a little bit longer than I thought it would, but I finished. I was done by 31, 32, I think it was. And that's even taking time off after college. And I had some hiccups along the way, but yeah, just keep fighting. Keep going. Don't let anybody discourage you. Those would be my words of advice.
Thank you. Yeah, thank you for pointing out, that about perseverance, right, and achieving your goals. Yeah. So.
And it sounds like if you'd asked any of us at 18 or 20, like what our path would be and how we'd get there, it sounds like none of us would have been remotely correct. And maybe we would have ended up where we thought we would, but we're certainly not ending up there like how we thought we would. So I don't think that was intentional by putting together this panel that way, but that certainly seems like one of the take-home themes to me.
Yeah, thank you. Yeah, exactly. And it's never too late to change. I did a career change when I was 30, so yeah. So yeah, definitely never too late. And Jennifer, you wanted to add something?
Yeah, I want to echo, what Dana said as well. There's a lot of people that I interview that did not get into medical school the first time, and here they are finishing medical school. And I actually, some of the advice I want to say is that I think some of my best residents, the ones that I end up matching into our program, are people that don't necessarily go straight through. I actually think that having life experiences, having a job outside of, just medical, your academic career helps you bring in another perspective into your training, and I actually really like the people that don't go straight through, the ones that go to college and then go straight to medical school. I actually find some people that decide to do other careers, that decide to do volunteer programs. Some of the programs that I love to see are Teach for America. That is a fantastic program. AmeriCorps, a lot of people do AmeriCorps, and that's volunteer organization, but people actually do jobs, and those are different community services. People go and do things in different countries, like, and I even have one of my residents was a lawyer, and then decided she didn't want to be a lawyer on Wall Street anymore, and went back and did a career. So there's a lot of different paths. Don't feel like you have to be stuck on this. Okay, I got to do this, got to do this. I actually think that you bring a lot of other gifts, to your journey, by being able to experience other things. And in some ways, if you kind of take a roundabout journey, you're probably more committed at that point, because you really want to do medicine or NP or psychology, if you've given your chance to experience other things. So I agree. Don't feel like you have to go one path. So.
Thank you. Thank you all for your advice and insight. And I just have one more question, and that is just if you could address a little bit about maybe how COVID-19 has affected your work. Anyone would like to jump in?
I think for my end at the clinic, I think like everyone else, we're doing telehealth medicine right now. At the Anza, we're not cleared to go back on campus yet. So all of our clinical practice and seeing consult and seeing students right now are all done on telehealth visit. It is very challenging, especially I think everyone can relate on this, diagnosing somebody without touching them and evaluating, doing all your full assessment. So we do a lot of referral, with this time because of those lack of capability of examining our patient in a hands-on experience. But at least we're here for the students, even though we're not there in person, we're still able to provide the services, but it has been very challenging for us as well, so.
Same for us. In March, we went almost full telehealth, but we still reserved a couple of spots for patients we needed to bring in. So we were still going into clinic, just our rooms and our waiting room was empty. We're back to 50% inpatient in-person visits now. And that task is just figuring out which providers are going to be seeing patients at what time, certain days, so we don't have everybody coming in at once and the waiting room being full. But we had actually started telehealth prior to COVID beginning, so we were sort of used to the system and how it worked, but it was hard for patients. They want to come in, they want to be seen, that's what they're used to, and it's what we're all used to. So especially elderly patients, our older population who just couldn't navigate video visits, that was hard. It's gotten easier, and we actually do have a program now with the medical students at Stanford will assist some of our patients who are having challenges with using telehealth, how to set up the system, how to use it so that they can access care when they need it. It's getting a little bit better, or they're coming in now. I'm seeing patients that I haven't seen since 2019. So it's actually nice to see them again, but yeah, we've had to adjust. And for us, for the mid-level providers, PAs and NPs, we even started doing nasal swabbing clinics, and now we're doing vaccination clinics. So So it's been interesting, but that always brings especially in the beginning, the risk of like, how do you take care of yourself and keep your family safe? So it was a struggle. It was a struggle. We're learning more, but we're getting there.
Okay, yeah, I would say about a year ago, probably, and I think everyone would agree, the hardest part of COVID was not knowing, and I knew I had to still go to work. Babies don't stop coming, they come. I still have to do my work. And it was just the fear of not so much me, but whether I was endangering my own family by and then as the pandemic went through and we started to learn more, that fear became less. I'm back to about 90% seeing my patients, 90%, and then still doing a couple telephone visits. But I do, I don't deal with as many older patients with acute, chronic medical issues. But now that everyone's vaccinated and are getting there, they just approved 12 to 15-year-olds, today, I think, or yesterday. My phone has been going off on where they're offering them, but now that everyone is hopefully getting vaccinated, we're going to hopefully go back, right, to being able to provide full care again. But I think it was hard, the unknowns. But even now when we see patients, right, we have to wear masks, we have to put goggles on, So it's not as personal. I would say the other challenge was education was really hampered because we couldn't have teaching conferences anymore. Our residents, we were trying to protect them, so we kept them at home a lot. So, medical students were like, one day the Stanford students were here and then they were all sent home. And we're not allowed, to come back to work for probably about 2.5 months. So yeah, so there were those kind of challenges, but I think we're overcoming them now.
Yeah, it's nice to hear the panel strike, optimistic tone for the, first time we're hearing optimism about this for a long time. I think, right, I mean, as I think one could predict, pandemic hits, life changes, mental health for many people, gets worse, right? The kind of like depression, anxiety, maybe people all of a sudden are more aware of how they're feeling. But I know very few people who, if I was in the house with my family for like the vast majority of every single day for the next like 14 months, right? So that, whether you have a great relationship with them or you have a stressful relationship, it's probably going to become more strained there. As Dr. Domingo said, life events still keep happening. Everyone still has to go to class. People are still applying to college, and that's a very stressful time. People still need to pay rent. So the pandemic changes some things, but it makes it more difficult to do the things that maybe you were just hanging on by a thread to do in the first place. So yes, definitely have seen like an uptick in request for psychological services, and in terms of like the maybe like severity of what people are reporting, in terms of like how how depressed or anxious or something that they may be feeling. So yes, glad to hear this note of optimism and say like, oh, we can almost exhale. But yeah, for everyone, it has been a really stressful 14 months, and if you're feeling that way, it's only because 95% of the population is also feeling that way.
Thank you all for sharing. And yeah, and at this point we're going to start closing, and I will pass it on to Deborah soon. But I would like to ask if you all don't mind sharing your contact information and putting it in the chat for our students. So if they have questions, they can contact you individually. Yeah, and I'd also like to thank Amelia and Alejandra for helping me with Q&A. Okay, thank you so much, all of you again, and for sharing your insights and letting students know about the different options they can take, the resources that they can find, and also some of the challenges. So thank you all, and I'll pass it on to Deborah now.
I do not see Miss Deborah. So I'll go ahead and share some of the resources. So to slow us down a little bit, share some love, some palabras, some words on the chat, and then go ahead and share some Zoom handle love with the reactions. We're in gallery view so we can see each other as well. Make sure that we let them know how amazing they are, and even more amazing for still being connected with community as a way to pass on the torch, encourage folks to stay steadfast in what it looks like is a very, very hard journey. But when we're, we don't give up, right? So I wanna just proceed from that moment of giving love and gratitude to ask all of you among the participants if you would like to unmute yourself and say palabras of gratitude, because we're in a virtual world. They can hear it nice and live, or vivo en directo in Spanish we say. If anybody would like to say a few words. And if not, then we can proceed to share a few resources. If you feel compelled to say something, please do interrupt me. So we want to share, of course, gratitude to our panelists today and the planning team. If you want to be involved for next year, feel free to reach out to Adriana. There's 3 more career panels we're planning for the next academic year. And we have been inspired so far by the 3 we've had this year. And of course, we want to bring all of you back. So far has been really inspiring and more accessible, right? Creating a more accessible dynamic that, yeah, I can actually do this. And here's the quote unquote, the technical part of it, the emotional part, right? And what it means and how it impacts our families and our campus journey as well. So thank you all for that. If you want to be part of planning committee, I'm sorry, for panelists, participants, students, colleagues, please do email me. We want to share that we have a student group called Latinas in Bio, Latina students who are considering medicine as a pathway for their careers. It's the first time this college has had something like this, and it's a great place for our Latina students to ensure they have a sense of community, someone who understands this pre-med journey in essence. Another student group is called the Medical Outreach Association, also called or known as MOA. They have Friday afternoon events with dynamic speakers every Friday, and you can reach out to their email and or social media on IG. And of course, because we are in the times that we want to make sure that our students have mental health resources. And so far, a few that we found that are decent in regards to price for folks that don't have insurance are BetterHelp, Open Path Collective, Latinx Therapy, Immigrant Rising for undocumented students. And of course, we have our in-house services at the Anza Psych Services, providing mental health with one-on-one and in group dynamic. Make sure to also access our Student Health Center as entry point as well, and know that you can get support there. And then regarding resources for health insurance, there is an organization called Healthy Kids Foundation. They are like an insurance broker of sorts. It can help particularly undocumented folks find insurance, but not limited to. And regarding career resources, as you saw, Helen, one of our panelists, is a counselor for the Career and Technical Education program. You can reach out to her to talk more about your journey. We have another counselor, Tom Nguyen, who is not here, who is able to also offer counseling for those that are in bio majors. And there's a great program called the MPS program, and you can access their email. And the program supports folks taking math classes and ensuring that you have success in those classes in your pathway to STEM careers, particularly. Of course, we have the wonderful Ms. Deborah Taylor, who works with the nursing department and is there to support students as they choose nursing as their academic career on campus. And then, of course, does all the things that, all the activities, orientations, referrals, what I call behind the scenes work to ensure that you have a successful nursing academic journey. Another great program is the Stanford Medical Youth Science Program. It's a 5-week online enrichment program focused on science and medicine. And there's 2 layers or 2 cohorts. One is for high school and one is for college. And we want you to find out more information for their 2022 program because the applications have already closed for this summer year for 2021. So make sure that if you're interested in Stanford's program, that you're looking out for next year. We always say in this work of creating a village for yourself, to build relationships now. Don't wait till last minute. Don't wait until the application's due. Start emailing that person at Stanford or start emailing Miss Deborah about how to get into our nursing program, because they're like our great panelists have shared, there's some hurdles, there might be some step backs, you might be missing a document or you didn't pass something. They will help you, not just tell you, hey, you don't have your ducks in a row, but let me support you in getting your ducks in a row, right? And that you're set up not just with the skills and the tools and the requisites and resources, but with the confidence. Miss Deborah, we missed you, but welcome back. Is there anything I missed that you would like to add to the resources section? You're on mute.
Sorry about that. I'm on my iPhone now. I'm here in Dublin and we've had a power outage in my neighborhood. No. Just as it was my turn. So no, you covered everything. I just want to thank everyone for joining and appreciate you for your passion and pursuing information to help further your health careers. So that really makes me excited. I'm happy for you all and glad that you could join us this evening. Back to you, Adriana.
Thank you, Ms. Deborah. And just real quick, is there any announcements on behalf of our panelists or our colleagues or students about things to come as we continue to inspire our students towards medical healthcare careers? Any announcements, upcoming events, things, deadlines, things to consider, vaccination sites, testing sites? What is the best website? Anybody know for checking whether vaccines available? If you can put it on the chat or say it.
The student health services are working on it, partnering up with some pharmacy in our local community here. So we're crossing our finger that we'll be able to deliver this on time the next month or so. But just keep an eye on those in our Return to Campus website. So
that is awesome. Thank you for that great announcement. All right, then. Go
Adriana?
ahead. Yes, ma'am.
You know, at Santa Clara Valley Medical Center, they're taking walk-ins for the Moderna and the Pfizer vaccine, and it's in front of Valley Specialty Center.
Where's the Valley Specialty Center?
It's just it's the building right next to the parking structure, not the main hospital, but the
glass one? The newer one
building. Yeah.
So as you drive up from Bascan and make a right on that light where there's always construction going on.
Yeah, yeah, that building. But they have Moderna and Pfizer. You can walk in.
So I'm gonna
Spread
put
the
here
word.
Bascom Road.
Santa Clara Valley Medical Center. Yeah, 751 South Bascom.
South Bascom.
Moderna and Pfizer. Walk
Ah.
in.
That is so awesome. And do you know the hours to that?
Oh, that I'm not sure.
All good. We can probably go to the website and they probably have it
Yeah,
up there.
SEC. Yeah, SEC. Yeah.
Okay. And thank you, Adrian, for posting those resources. Appreciate you. And you too, Helen, for posting the information regarding UC Davis. They also have a pre-health conference that is very, very informative for the Latinas in Bio that were actually able to attend it in person before pandemic. They were super, super happy that they went and took that 2.5-hour drive from San Jose area they left like at 5 a.m, I think, to attend it all the way at UC Davis and come back the same day. But that's, talking about the visionary, the dream, the passion, to consider this medical journey and getting as many resources as possible. So with that said, I would like to say thank you to everyone, including our co-sponsors that have really been on this ship of coordinating career panels, being in community with each other, just a dynamic team. So the first one is the STEM Success Center with leadership by Yvette, the nursing department. Thanks to Ms. Deborah once again, who has been at the heart of that department and making some key, beautiful processes and policies, with the support of Anita and a great team there. Anita, the dean of that division. Athletics department, the Student Success Center. We have here Alejandra, and regarding athletics, we have Mr. David Kobata. And regarding career technical education, you saw Helen in her light. Again, she's a counselor that you can reach out to. The student health services, the team here is Amelia and Doctora Nogra, but not limited to, as she said, Dr. Nogra said, she has a great team, and I agree. We have the Office of Equity, which is what I represent and very thankful to be a part of. And still growing in this position, in this role here on our campus. And of course, our community partner, National Association of Hispanic Nurses, the San Jose chapter, the Greater San Jose chapter. All these partners have made today work. So thank you, thank you, thank you, thank you for your time, your resources, your creativity, your ethic of care, in inspiring us in times of so much grief and loss. At the health level, at the social, political context level, that we remain in our humanity, in our health, in our safety, so that we can continue inspiring, we can continue healing, most of all, and that maybe, right, like 5 years from now, even we can see the next generation, particularly of people of color, BIPOC folks, getting into this career, and that I'm so proud to know all of you as a way of village, that has supported our students or older students, ¿verdad? Not just the incoming 18, 19, 20, to make a choice and be like, I want to do this, and I feel I have the support to do this. That is a beautiful story we want to uplift. In the meantime, any other comments from our planning team? Y'all feel good? This is the last ride in this academic year. Much love to our panelists. May you all have the self-care after this workshop, and may you all stay safe and healthy. So much gratitude for all of you. Thank you so much. I'm gonna stop recording.